So I'll be applying a halter and a lead here. So this part over the nose, back around the ears. That off. And now that I have that on him. Alright, so I'll be applying a twitch here. So what I'm going to do is get a hold of his lip there. And then slide this off. And start to apply some pressure. I got a hold of it, and then I can wrap this around. Alright. My name is Chase Gratz, and I'm going to be demonstrating using a chain shank on a horse. So what I'm going to do is take the chain and run it through here and over the top of the harness so that it doesn't rub on his nose. I'll bring it back down through that side and connect it to this bottom ring. So now the chain's running through over his nose over the harness. So I'm going to demonstrate another way to use the chain shank. What I'm going to do is run it through this side up from under this hook, and hook it up here. Now if I give some slack, I can get it up under his lip, right there. And now I have better restraint of the horse. I'm going to feel for a pulse on the facial artery. Feeling right under the jaw. About 30 for that, and then I'm going to listen to his heart to see if his heart rate matches up. I'm going to be sculpting his lungs, listening to his lung sounds and getting a respiratory rate.
How long do you want to be walking them up? There. So who's wanting to put feed in there?
Lung sounds are clear, and respiratory rates 12, which is within normal limits. So I'm going to be checking the horse's temperature now. I'm looking for a temperature in the range of 99 to 101.5 as normal. Horse's temperature is 99.8, so he's within normal ranges. I'm going to be drawing blood from the jugular vein. So the first thing I'm going to do is to wipe the area with some alcohol to clean it. And then I'm going to occlude the vein. I'm going to insert the needle. And the vacutainer is filling the tube up with blood. And then I'm just going to hold the area off after I remove the needle. I'm going to be putting a support wrap on the front leg. So I'm going to start with the padding layer, which is just cotton padding. I'm going to take some powder wrap to secure it. I'm going to start at the front. I'm going to start working my way down the leg. Take it back up. I'm going to be putting a tail wrap on this horse. So what I'm going to do is lift the tail. I'm going to start at the base of the tail here. First wrap around. Here.
That's hard to work with.
Got that in there to keep it from sliding. Just gonna continue to do that.
Send the baby stay out.
Yeah,
It's okay.
was it pretty big or anything?
Yes.
Was it really?
Not like maybe
You
it's
fill that up on it, eh?
yes. My baby eating no better.
My name's Chase Gratz. I'm going to do a sub-Q injection in a horse. So the first thing I'm going to do is clean the area with some alcohol. Next I'm going to tint the skin. And I'm going to be giving the injection. And I'm going to insert the needle in the tint and pull back to get negative pressure to make sure I'm not in a vessel. And then I'm just going to inject the fluid. And I'm going to pull out and hold off when I'm done giving the injection. So this is just a vitamin injection for this horse. I'm going to show the difference between how I give a sub-Q injection and intramuscular injection, and then I'm going to give this intramuscular. So I just make sure I stay within my boundaries here for giving an IM injection on a lateral cervical area, clean with some alcohol. And if I was going to do a sub-Q injection, I would tint the skin and then give the injection inside the tinted skin. But this is going to be IM, so what I'm going to do is just pinch right here. I'm going to go into the muscle, and then I'm going to aspirate to make sure I'm not in a vessel. My name's Chase Gratz. I'm going to be doing an IV injection on a horse. And the first step is I'm going to clean the area with some alcohol. Next I'm going to occlude the vein so that I can see it. I'm going to insert the needle, level up. See the blood entering the syringe, and then I'm just going to push. And then I'm going to hold off that area after I withdraw the needle. Alright, my name's Chase Gratz. We'll be giving oral medication to a horse. So insert the syringe, point it. Insert the syringe and point it caudally. And then I'm going to lift his head up and rub his throat to make sure that he swallows. I'm just checking the setting on the radiograph machine to make sure that it's set appropriately for the view that we're taking. Which everything is set, and the distance should be good. So I'm gonna get my gloves on and then position the cassette for the radiograph. So I've got the cassette position behind the patient's leg, and now I'm gonna push this button, take the X-ray.